I went to the dentist, I told the hygienist that, you know, when she asked me that question, oh, how often do you floss? And I said, well, you know, I'm not good about it every day, I have to be honest, but I'll tell you what, I do brush my hair every day.
I'm sure that was a big hit.
Did you get credit?
You know what? I kid you not, we had a discussion about that because her response was, oh my God, you know what? Honestly, I don't even brush my hair every day. Some days, like today, I just put it back in a pony. You work on brushing your hair every day. I will work on my flossing.
Well, I did brush my hair today, so I'm covered on both. I flossed and brushed my hair. And brushed
you are way ahead of most of the population, probably.
Yeah, I actually have a new dentist. She sold her practice because she has an autoimmune disease and she had to stop practicing. And so I haven't met this dentist. So boy, there could be a lot of issues today.
I'm scared.
And all the COVID requirements, I have to wear a mask. They have to come out and get me. Yep. You know, my son has to leave as soon as he's done because I'll be longer. So I had to have my dad come and get him. And you know, so it's like, I mean, I'm glad I'm able to see them and I'm glad they're taking precautions, but it's a new world we're living in.
It is a new world. Yes.
Absolutely. Well, it's 11 o'clock, so we're going to get started. Good morning, everyone. Thanks for joining us for our Training Thursday. We have a terrific presentation coming, how to address substance use in the workplace. And I'm going to introduce our speakers. First, Chris Wardlow is contracted to Outagamie County to help coordinate the county's substance use prevention efforts. Chris serves on the Prevention Committee of the State Council on Alcohol and Other Drug Abuse, known as SCAODA, and was a member of the ad hoc committee that developed the SCAODA Workplace Prevention Report. Chris has been involved in a lot of other reports as well, but especially for this presentation, he was on that Workplace Prevention Report. Jill Gamez, and she's got a whole bunch of letters after her name, serves as the Executive Director of Arbor Place Incorporated, a behavioral health treatment center with locations in Menominee and River Falls, Wisconsin. Jill serves on the Planning and Funding Committee of the State Council on Alcohol and Other Drug Abuse and chaired the ad hoc committee that developed the SCAODA Workplace Prevention Report. We're grateful to have both of them join us today for this presentation. And I'm going to turn it over to you now. Chris, I think you have the PowerPoint, so take it away.
Okay, hold on just
And please, everybody, if you could mute your computers, that'd be great.
Is that there?
Yep.
All right. So thank you for the opportunity. I want to make sure and let folks understand that when we talk about this report that this presentation is really introducing folks to, I want to make sure people understand that Jill was the chair of this committee and provided us with the leadership to push this report through. So I came out of the bullpen on this one halfway into the process, just because this committee, like a lot of our committees, we'll talk more about how these committees work, but this committee, when you bring a group of professionals and volunteers and folks together to work on these reports, sometimes folks go through transitions in life, either with jobs, job responsibilities, other life events, and they have to step away from this committee. And this particular committee that produced this report got hit pretty hard by this. So as interim chair of the prevention committee for SCAODA, I was asked if I could step in and lend a helping hand. And so the time that I was able to spend on this report was a lot of fun. I got to work with a great team of dedicated people. So
I'm happy to hear that you think it was fun, Chris. That's awesome. It's a lot of work.
But the process, no, we're not going there. The process of working and coming together as a team of people was good. I liked it. So
Yeah.
All right. So today this is what we're going to talk about. We're going to introduce you to this report, which will be coming out real soon. And we'll tell you how to access
About
it.
what you want for lunch. I'll check in with you in about 5 minutes, okay?
Oh, cool.
I'll check in with you about 5 minutes. I'm listening to some.
Let me know what the menu is. That's nice. We're getting lunch.
I am so sorry. I'm not muted.
That's fine. And then I want to provide folks with just a real quick overview. Jill and I will provide folks with a quick overview of SCAODA. People need to be aware of and stay in touch with and connected to SCAODA. And then throughout the hour, we'll hopefully try to infuse ideas for how to use this report and some of the ideas with employers. So you want to add anything, Jill, to that?
No, I think that's good. Hopefully at the end of, this session, you will have some ideas that you can take back to your own workplaces, to coalitions that you may work with. And obviously our goal with this report, as well as many reports that are put out by SCAODA and the various ad hoc committees that are established, is that it's a usable document to hopefully create opportunities and change in your local communities.
Mm-hmm. All right, so here's the report we're talking about. This will be available for download from the SCAODA website. It is pretty close, but I think given what DHS, the State Department of Health Services, and their staff dealing with right now, they weren't able to get it done and posted in time for this. But I'm sure that Phil and others will put the email out and let people know when this is available. If you haven't been to the SCAODA website and you're looking for the reports that Jill referenced, you'll see there on the left the tabs. Just click on reports and it'll take you to a PDF version of all the reports that are available. I know there's going to be there will be hard copies distributed to the Alliance partners. I don't know that there will be a lot of them, but everybody that's an Alliance member, part of an Alliance coalition, I think will have the opportunity to get a hard copy of this. The other thing I'll point out on the website here for SCAODA is if you see that bottom red bar, I know Phil has sent out a lot of emails alerting us to the new dashboards, the data dashboards that are coming out from DHS. This is another place that you can, in fact, I think one just came out yesterday, was launched around alcohol consequences and consumption patterns for the state. But you can access all of those on this site as well. They're below that red line. So a little bit about the council. This is in state statute. It is the council sits within the governor's office and is charged with providing leadership really around substance use issues in the state, and providing information to our elected officials, providing, serving in an advisory capacity to our state agencies that have substance use programs and initiatives, and then also to serve as a voice and to create awareness and promote awareness about these issues throughout the state. Jill, anything else?
If you have not interacted anyway or been engaged at all with the State Council on Alcohol or Other Drug Abuse, or SCAODA, I really encourage you to do it. I know that many of you are more than likely engaged in your local communities and local coalitions and trying to create change there. Well, this is on the state level. In our field of substance abuse prevention and treatment, it's really important that we have a voice at the state level. And this is the vehicle to do that. The larger group, as well as the committees that are a part of SCAODA. So like I said, if you have not explored anything about SCAODA or the committees, be open to it. It's definitely a group that is a vehicle for change.
I agree. I certainly agree. So this is the mission of the State Council. The actual council itself, members are appointed by the governor. So if you're interested in serving on the council, you go to the governor's website, and there's a place where you can go and fill out the forms and provide information to see if you can get appointed. It's a pretty involved process. It's almost like applying for a job. But if you're passionate about it, it's worth doing. And then there's also members from representing the secretaries of each agency, state agency. There's legislative staffers there, or we actually have 2 or 3 of our legislators that are pretty good about coming to all of those meetings. And then other people within various services related to AODA, and consumers are represented. So it's a broad network. There are 5 standing committees. Jill is on 2 of these committees, the Intervention and Treatment Committee and the Planning and Funding Committee. I am currently the interim chair of the Prevention Committee. All the meetings are open, so at any point you can go and attend. The agendas always provide opportunity for public comment. So if there's an issue that you want SCAODA to be aware of, or you want to make people aware of, you can attend these meetings and fill out the little form that says you'd like to speak during public comment. And then also be aware that at that website that we just looked at, all of the approved agendas and minutes for the full council as well as the committees are posted on that website. So for example, tomorrow, I think, is our full council, right, Jill? Is tomorrow?
Correct.
And you can go on the SCAODA site and download the meeting packet for tomorrow's meeting. It'll have all the information that's going to be discussed at the meeting, as well as approved minutes and things like that. So again, like this is a great way to stay informed about what's happening at the state.
Mm-hmm.
Anything else on that before I move forward, Jill? No?
Nope.
Regarding ad hoc committees, these are the committees that generally produce the reports that, like the one we're going to look at today. You know, those are temporary. Generally, they're only convened for 12 months, but extensions are granted. They're formed by the chairs of the standing committee. So for example, this particular ad hoc committee that put this report together was convened by, I don't think it was me, I think it was Scott Stokes, who at the time was the chair of the prevention committee. Then we, you know, once these reports are formed, they're given a charge, specific kind of responsibilities. And then throughout the process, the committee members provide, the ad hoc committee members provide updates to the, at the standing committee meetings and get input from them. Once the work is done on a report, it has to be approved by the standing committee. So in other words, once we were done with this report, we had to bring it to the prevention committee and have them approve it, make whatever revisions, changes that they needed to make to it, and then approve it. And then once it's approved, it is sent on to the full council with a motion for the council to adopt it. So if the council doesn't adopt the report, if they have a problem with it, then you've just spent a year or more in a good exercise of education and team building. But generally, SCAODA will allow the ad hoc committee to make whatever revisions that they feel need to be made, and they'll allow it to come back for a second time. So, Jill, anything more on that?
No, I just think that the process that Chris kind of laid out for you is just important to understand that it is quite a process to go through and get to the point where we have an accepted report. And so a lot of work has been put into it. There's been a lot of feedback, a lot of you know, different thoughts added. So it's quite the process. It's a good process to be a part of. And so the product that we will start to share with you here shortly, it's not going to be all inclusive because this area or topic area for the report really is very, very large. There's a lot of different tracks that we could go down, but the process is good to get you the product that we're going to share with you, and it's a starting point. That's with a lot of the reports that come out of SCAODA, it's a starting point and a tool for local communities to use.
Right. Yeah. And I think the other reason we wanted to share this information about SCAODA and kind of the process is to let you know you can get involved. You can be involved in the prevention committee. You don't necessarily even have to be a member of the committee because they're open meetings. You can attend the prevention committee meetings. And then when these ad hoc committees are formed, the committee chairs usually are reaching out to people in the community, whether they're in prevention or treatment or in businesses or, you know, any occupation or organization related to the topic. So there's opportunities to get involved in producing these reports as well. So please know that. Again, here was the ad hoc committee. Again, Jill was our chair, our fearless leader. But when you look at the members, other than Frank Burris, who's a retired educator, you know, the three of them run healthcare agencies. So in addition to running their agencies, and doing everything that comes with that responsibility, they were also working to put this report out. So it's pretty impressive when you think about this.
I'll also add that in trying to make up the committee, it was important to us that we really did our due diligence to reach out and engage someone to be on the committee, or the ad hoc committee, from the business community. Because a lot of times, you know, in some of our daily work, we sit around the table with somewhat like-minded people or others that are doing similar jobs as us. This is a report that we want to make useful not only to local coalitions, but also to business owners. Also have to remember that each one of us may work at a business. So it was interesting when we went through this process that myself, as the executive director of my organization, that I also learned things and was able to implement things within my own organization. So keep that in mind too. There may be practical applications at your workplace, as well as, you know, what are other workplaces, other businesses in the community, how might this help them?
Right.
We have some members that started off with us that kind of wore that hat when they came to the table. Again, as life happens, people take different positions, there's different priorities that come up in the workplace. And many of you may have experienced this too in coalition work. It's easy to understand why we as prevention professionals or people that are in the behavioral health world should be at a table like this. But to try to engage someone else, maybe that's in the, you know, a glass making factory. Hey, can you know, someone from management join us at this table? Sometimes the rationale is not as clear, and that's true for even putting this committee together. You know, businesses have to make that decision on if it's time well spent or not. But we did look at different people to try to get to the table, and so those names are also, they will be reflected in the list of people that contributed to this report.
A big contributor to just helping keep the report on schedule, helping with revisions, helping with logistics. It comes from the staff at the Department of Health Services. And so you can see here who staffed this. And we got a lot of help from them. They played a huge role in this. Here are the people that Jill was referencing, that we were able to reach out to these people when we had questions or a particular issue that we needed more information on. So all these folks contributed their time and their knowledge and expertise to portions of the report. So a little bit about what's going to be in the report. You're going to see it, so we won't spend a lot of time on it. So there is the front matter in the report. We provide a little bit of background. There's an executive summary, a glossary of terms. Now remember too that one of the target audiences for this report are people, employers, or people that work in the workforce somehow. So we wanted to make sure that we provided enough background information that we weren't going to lose them. So we provided a glossary. We gave some background information on it. And so that's why those things are in the front of the report. Jill, anything you want to say about the front matter?
Nope.
the actual body of the report where the recommendations are, we, and we'll talk about this a little more, the committee, Jill and Michelle and Eva, felt it made sense to divide the report into sort of phases, so pre-employment and during employment. And then the last section covers and talks about how to partner, encouraging employers and businesses to partner with the community. This is, I think, a real helpful resource in the report. In fact, I think the report itself, the body, this part of the report is maybe 20 pages, 21. This part of the report is equally as thick. So we provide there was a lot of information provided to help create awareness and educate people in the business sector around some of these issues. Another kind of quick note that I'll make, because so much has been discussed and talked about by other state reports around the issue of tobacco, and that's been an issue that's been out there for quite a long time. We felt that we wanted to just make note that certainly tobacco and nicotine as addictive substances and health compromising substances are very important. But we decided that when we addressed it throughout the report, that we were really including it in a broad term of substances. So, and then we added a section in the appendices, because certainly tobacco is huge. It's one of our most addictive substances. It causes a tremendous amount of problems health-wise for workers. So we didn't want to ignore it totally, but we also wanted to acknowledge that it was covered extensively, and it has been in other documents and reports. So we weren't going to we weren't going to spend a lot of time in this report on that, and we wanted to cover some of the other important issues. So here is just a quick, this is the charge to the ad hoc committee in a nutshell. We don't have to read this to you. The full charge is toward the front of the report. But basically it was, research and identify evidence-based practices around prevention, treatment, recovery, and then make recommendations. And kind of tailor the knowledge to and make it Wisconsin specific too, or try to. All right, so let's look real quick at and again, this is really to make the case to employers. We know this. I think the people on this call know this, but why is this such a big issue? When you think about how substance use problems impact employees and employers, I think we could develop a pretty extensive list. But we know that the cost is significant to employers and we'll look at some of the data around this as it relates to healthcare, work productivity, accidents, the culture at work, things like that. This has a huge impact on the bottom line for employers. This is a great tool. We cite an article that's based on this tool, but if you're looking for a tool to use to, maybe you're working with a business or an industry and you're encouraging them to incorporate some of what we're going to be talking about. this morning. This is a tool where you can go and type in information about that business, about that industry, the line of work, the number of employees, the state that that business is located at, and then it will produce for you a number based on all that information of what substance use problems are costing that business or that employer. It's a great tool, and it's at shatterproof.org, but that will be in the report as well. So some of this data that I'm going to show you now comes out of this. So when you look at who is in the workforce, I think the number that's I don't want to say surprising, but really speaks volumes here, is that about 70% of adults with a substance use disorder are employed. So they're in the workforce. So if you're an employer, you're going to have people working for you that are struggling, and you can see the percentages based on specific disorders as well. So it's prevalent. It's prevalent. This is hard to read, but I just wanted to throw this in there. Again, this comes from that calculator that we were just talking about, but it breaks this down by trade. So the type of work and the percentage of employers within each industry that have some substance use disorder. So it's pretty interesting. I mean, and as you look down the list of trades, nobody is exempt here. You know, this substance use, we know in the work, because we're all prevention folks, we know this impacts everybody, and it doesn't discriminate. When you look at the
thing to keep in mind, I'm sorry, Chris.
Go ahead, jump in, I'm sorry.
The other thing to keep in mind is that this data is about the employee themselves. And we know that if there is someone in your family or in your household that is struggling with a substance use disorder, and I'll also put mental health in there as well, that it can greatly impact you. So keep that in mind in terms of, you know, after this presentation, if you're thinking about how to use some of this information, that if you're trying to engage a new partnership with a local business, or perhaps even the local chamber of commerce, or whatever it might be, these issues of substance use disorders and mental health impact not only the employee, but their family members. So I have to tell you, I went for a walk with a friend this morning, and you know, the world is very different right now for all of us, right? I was thinking about this ahead of time, thinking, okay, if I had to choose, like, okay, is now the right time to take this information and maybe try to engage a new partnership with, you know, the business across the street from me, or to get somebody to the coalition table? I'm not sure. There's a lot of things changing right now, right? But the conversation I had with my friend was, you know, her son is struggling, right? Things have changed greatly for our children. They're doing school from home. They don't have as much contact with their kids, or excuse me, with their friends. They're not able to do their sports or band or the various activities. And she was very concerned about depression for her son. Now, you can't tell me, you know, that friend of mine who is a mother, that doesn't cross her mind when she's sitting at her work desk. Right. That she might not take some extra time to make that phone call to check in on her son. So when it comes down to it, that impacts work productivity, right? Yeah. So there's all these different areas where these issues infiltrate us. So let's not only keep the employee in mind, but also their family unit.
Yeah, absolutely.
Mhm.
When you look at healthcare costs, this is really striking to me. And you look at who is costing the employer the greatest amount. And what's really striking to me is certainly this makes the point that your employees that are struggling with a substance use disorder are generally requiring or needing more health care. So there's a cost there. But when you go down toward the bottom and you look at why this is so important, you look at that worker in recovery now, okay? And compare that worker in recovery to the average general adult worker without without necessarily a substance use disorder. The point here that was so striking to me, and I think to us as a team, was that helping someone get better, helping them and supporting them as an employer in their recovery. And I think this is equally true with mental health as well. There's huge financial benefit to the employer, huge, right? So this is sort of another way we can frame this to help employers and business owners understand this. Here is just something of interest that I think relates to the topic, and that is, when we look at the most common reasons why people are not pursuing treatment for a substance use disorder. Certainly a significant number are just not ready. But look at the middle two there, 31% and 21%. This again is related to this report. For almost a third, it's the cost. They can't afford it. So later, in the report, we talk about coverage for treatment and EAP services. And then you have about 20%, so 1 in 5, who aren't pursuing it because they think it's going to have a negative effect on their job, right? So this is another reason why getting employers to support this and promote this is gonna, one of the outcomes will be more people getting help and treatment and moving into recovery, and then become productive citizens and employees.
Question, Chris.
Yeah.
Where it says 18% fear stigma from neighbors or their community, does that include their families?
That's a good question, Irvin, and I don't know the exact answer to that. But I would imagine it does, but I can't say for certain. There was probably another category in the data that I did not include in this, only because we were trying to focus on things related maybe specifically to employers. But that's a great question.
Yes, because oftentimes, family, relatives get together and, obviously it becomes a party thing for the entire group. Right.
Right. So we're going to move into the recommendations now. And we'll talk about this first one, and I'm going to kind of defer to you, Jill, on some of these because I wasn't a big part of some of these. So
sure. So first, I just want to establish again how we approached putting this report together. So there's 3 different areas. One is pre-employment, and we'll start with that. The second is during employment, and then the third is within the community. As we started to brainstorm at the beginning of this process, we didn't only want to focus on what employers should be doing, because there's certainly other areas, again, in the community and before someone's even hired, that contribute to that employee's or potential employee's well-being. So pre-employment, you know, we wanted to look at employment readiness programs. So we did have individuals from the Department of Workforce Development come and attend one of our meetings, and we had some ongoing kind of discussions or consultation with them throughout this process. But here we have a State Department that is all about working with individuals in order to make, to contribute to their employability, to contribute to the workforce in this state. And so that entity and the services that they provide are really key when we're looking at this pre-employment area. We spent significant discussion time on this, and I'm really pleased with what the recommendation is. If you read it there, what we recommended is that DWD and other state agencies, where it may apply to them, should provide linkages to services, both prevention, treatment, and recovery resources. Sometimes that gets challenging at the local level. As we all know, when you have staff turnover, they need to relearn or learn for the first time what all those local resources are. So that is an important piece, but what specifically we included in this was, hey, let's look at the larger picture and their online presence, because we know a lot of people start their job search online, and they may go to the DWD website in order to link to the job listings that they host on their website. And also there's a lot of information about the programs and support that they have available. So right at that point, let's include some information for those people visiting that site that that list resources. You know, when you don't talk about something, that contributes to the stigma, right? So let's put it out there. Hey, if you know, you're struggling with some substance use or mental health, let's connect you with some resources, because we know it impacts your employability. So that's where we wanted to see those resources listed within their online presence, also within any local or state level workforce events, at the local employment offices, and also within training programs. Let's just start talking about it. Let's link people with services in order to reduce the barrier to employability. And so I do know that Roger Frings, who is the chair of SCAODA, had shared with me recently that he knows that some of that work at DWD is already starting to be done. Now that comment was made before we were hit with our with the COVID pandemic, but it was really pleasing to hear, because I think it's a relatively simple step just to make sure that we have resources on the online platform and explore how we can, different areas that the other resources can be promoted, that, you know, that change already started to happen.
Yeah. So it was interesting too to learn that Secretary Frostman, who's the secretary of DWD, was open at a full SCAODA meeting about himself being in recovery, a person in recovery. So I think that helped with this. He understood. And it'll, like Jill said, it'll be exciting to see where this goes.
Comment, I'd like to just make a comment, please. So
Yeah.
following up on what Jill just said, you know, it seems like such a simple statement: avoid contributing to the stigma by simply integrating the discussion into the whole employment process and not separate it out as something different and unusual.
Right.
Right. We do that with so many things, don't we? Oh, you need this? Okay, go to this office down the hall. I can't talk to you about that.
Right. Yeah.
And even in developing this recommendation, we went back and forth in terms of how much we should or could expect from the local job centers that are in many of our communities. And we don't expect the job center staff to be experts and provide direct health or help, excuse me. And we had discussions about, is the brief intervention, the expert model, could that be, is that something we should look at? And we didn't go that far. What's important is to start with what we can start with. And let's be about it, and let's know the resources, and let's connect needs with the resources in our community. So one thing that you could do with this recommendation at the local level is, am I right in thinking that many of us on this call work with local coalitions?
Yeah.
Yeah.
I think so. Yep.
Okay, so within your coalition, do you have someone from the local job center, if there is one? Do you have that person at the table? If not, here's a report that when you can print it out, you take it right to them and say, hey, we perhaps could work together on some of this stuff. That is a tangible piece for you.
I'm just gonna check in real quick. Phil, do we go till noon or noon 30? What's our time? I can't remember.
Generally till noon, but
Okay.
we have had presenters in the past who have gone beyond that. So, we're not going to stop you at noon if you
Okay.
have some more to share.
Okay.
I'll talk quicker too, or less, I don't know. The two. I'll move on to the pre-employment drug screening. Again, during this process, one of the first things that came up in discussion was drug testing in the workplace. It's a big topic of conversation. When you look at the unemployment rate, and when the unemployment rate in Wisconsin was very low, employers were expressing that they had a hard time filling the open positions that they had. And some employers were choosing to, you know what, when we have a good candidate, what throws them out of potentially being hired is when they fail that drug screen. God darn it, well, we're just not going to do the drug screens anymore because we've got positions to fill. And, that's the focus. So, honestly, drug screening and prevention may not necessarily be it felt a little out of sorts, but at the same time, it was really important for us to include this topic within the report because it's very pertinent to employers. There's two areas to look at when you're talking about drug screening in the workplace. One is pre-employment. So you can certainly make a case, and there's data and statistics to support it. Well, Chris just shared some of them, that when you have someone as an employee in your workplace and they're struggling with a substance use disorder, it costs you money. So one strategy is to try not to hire people with substance use disorders. That I mentioned because it's kind of underlying this topic area. To say that pre-employment drug screening is going to totally address that issue, of course, is naive. And we want people in Wisconsin to be employed. We certainly don't want to contribute to the stigma against people who are struggling with substance use disorders. But as a business, the recommendation here is that employers in Wisconsin should consider, we did not say that they should, and we did not say that they shouldn't. We said that they should consider implementation of pre-employment drug screening if it's deemed necessary for the safety, health, and well-being of employees. And it should include policies based on best practice. So within the report, there are some of those areas that are really important for employers to take a look at within their policies. Of course, we have the caveat in there that they should always consult their lawyer on policy issues such as this. But it's things like, what substances are we going to test for and why? If an individual is using this substance, we know or we believe that it's going to be detrimental to the work that we expect them to do while they're here. There has to be a justification for that.
Question. So if an HR director is interviewing somebody and they're the best candidate ever for that particular job, and the organization itself has a policy for screening, and they're scared to death they may lose this employee, it sort of seems like they're kind of caught between a rock and a hard place.
Absolutely, yeah. And for the employers that we did have at the ad hoc committee table for a while, that's exactly what they expressed. And so employers at times have felt and have made decisions to say, you know what, we're just not going to drug test, so that we don't have to disqualify that candidate that we really wanted. Because once you have a policy in place, you need to follow it, right? Otherwise, as a business, you're opening yourself up to litigation. Absolutely. And so this is important. It's not just for blue collar industries. It's also for white collar. Businesses can have different policies for different sectors of jobs within their organization. There just has to be a justification for it. You know, if everyone that's applying to, like within my own organization, if everyone that applies to be a residential treatment worker, I'm going to drug test, but anyone who applies to be a manager, I'm not going to drug test, I had better have a justification for why that's done. So these are the things that are included within the report with some of those additional thought-provoking questions that are really important for employers to consider.
This was a section that I worked on quite a bit, and actually I put some slides toward the back of the presentation to go into more detail about what this will look like or could look like. But I would say just real quickly, you know, working on prevention within a workplace is really, in a lot of ways, very similar for us as prevention people as the work we do in communities. It's, you know, and if we have time, we'll look at it, but it's really focusing on addressing risk factors and promoting protective factors within that work site, within that company. And we know as prevention people what risk factors contribute to an increased likelihood, and we know what kinds of things make it less likely. So a lot of this section here focused on that whole concept of risk and protective factors. And this was an area too where we also addressed a little bit of just briefly trauma-informed, being trauma-sensitive and trauma-informed. So I'm not going to spend a lot of time here. Hopefully we'll be able to get to more detail on it toward the end.
Question.
Yes, Irvin.
Is there, in your new document that's going to be coming out, are there things in there, are there, how should I say, is there information that different employers can lift to use for their own company policy manuals, policies and procedures manual? What we've included in there are links and sources for
employers to go to look for that type of information. So we direct them, and 2 examples, our own DHS, Department of Health Services, has a toolkit for employers on wellness, and in that on worksite wellness, and included in that toolkit are strategies around addressing substance use. So that's one. We have a link to that in there. I checked both links. They're still good. And then the CDC also has a similar tool, an interactive tool for employers. That is in a lot of ways the same as the states, but maybe a little bit more involved with some additional resources. So yes, links to those sites are in the report.
Thank you.
You bet.
So here's the workplace drug screening. So we talked about the pre-employment drug screening. This is during employment. Those policies should look very different because they are implemented for different reasons. Again, the recommendation is that before implementing a drug screening policy, employers should consider whether drug screening is required, necessary, beneficial for employees or the organization or industry. And then within further the write-up, it does have bullet points as well as the pre-employment one too. If you're going to have a policy, it should specify X, Y, Z. Employee assistance programs. This is obviously it's a service that an employer can provide to its employees. Typically in medium and smaller companies, it's going to be a contracted service. So Arbor Place, we are a contracted provider with some EAP companies. So there's Empathia, there's Theta Care has an EAP program that they have as a product for employers, and Empathia is another big one in Wisconsin. So those EAP companies then usually contract with service providers, and so that's where we come into the mix. Some companies are big enough that they run their own EAP program. So 3M, they have their own in-house EAP program. Smaller or other companies, again, choose to contract out for it. Here's an interesting piece for all of you to keep in mind within your own organization that you're employed with. But my organization, Arbor Place, we did not have an EAP that we provided to our staff. Because as a small business, it always appeared that it was just an expense that we couldn't afford, right? We know that other costs are associated, but what we found is that the company that we purchase other business insurance from, they actually have a quote unquote free EAP service that's available to us because we purchase other insurance products from them. So we have an EAP program and it didn't cost us anything as the business because it was connected to other insurance that we had purchased. So that's just something to keep in mind too. For us to implement an EAP program or make that available for my staff, it didn't cost me anything other than the time to know or to learn a bit and then know, well, I need to do a little bit of research here. And lo and behold, and you know what? Just this week, I promoted our EAP program to all of our staff because we are in a challenging time in our world and in our communities. Now is a perfect time to make sure that employees and staff know that there is a service that they can access to support them. Going specific to this recommendation, it was important to include in here that an EAP service that it would benefit the employer to check, okay, this EAP service that I'm going to offer to my staff, Do they have substance use disorder services? Because again, from my experience contracting with various EAP companies, they look for mental health clinicians. They don't contract with us for a clinician that is a substance use disorder counselor. They only want to contract with us for our mental health. Now, fortunately, within my organization, most, if not all, of my clinicians are duly credentialed, but that is not the case in all clinics and for all providers. So we don't want to overlook that piece about, okay, so you can help my employees with some family dysfunction, or perhaps if they're experiencing anxiety, what about substance use? And are those clinicians that you're contracting with, do they know what they're doing? That is a whole nother conversation, right? That gets into credentialing and all that kind of stuff. But you want to, but it's a little bit more work, but those are the questions that businesses can ask. Also, we included the terms about, you know, are the providers that are providing the services through EAP giving evidence-based care, and is it trauma-informed care? So that's just some of those elements that a business owner or employer can do a little bit more diligence in checking out what they're offering as an EAP program, if that is an option for them. Here's a little bit about employer-sponsored health insurance plans. So many employers, obviously that is the way our system is set up, that most people get their health insurance through their employers. Yes, there's the Mental Health Parity and Addiction Equity Act, but let me tell you, insurance companies are hard to work with. And within the past year, you know, there's been I'm sure many lawsuits, but a significant lawsuit against a big health insurance company that in California, they were found to have, you know, inadequately denied substance abuse services when they shouldn't have. So again, here's just an area where an employer can do a little bit of more diligence looking at who they're contracting with to provide that health insurance to their employers, and also to make sure then that substance abuse and mental health services are available to their employees. Part of it has to do with looking at, do you have providers in your community? Not all communities have mental health and substance abuse providers. But I will tell you that in Menominee, where Arbor Place is located, we have Anderson Windows right across, an Anderson window plant right across the street from us. And when we moved into that location, someone from HR from 3M and myself talked, and we compared notes to see, okay, this is insurance that we offer our employees. Are you in network with them? Because that happens too, where there's health insurance plans, and to be in network, that employer has, or employee has to go a half an hour away when there may be a local provider right across the street. How does that impact the workplace? Access to care, time away from work for those appointments. So some of those are the real fine details, but it does impact employers and businesses. The last recommendation there is recovery supported work environments. And Michelle Devine-Giese was on our committee. She is the CEO of Apricity based in Appleton, and they also have a site in Milwaukee. And they have been doing excellent work, great work, many years in combining both treatment and employment. I had the opportunity to tour their business in Appleton, and it was amazing. But there are components that they have implemented within their workplace because their employees are all in recovery, early recovery. There are pieces that you can take from that and implement in any workplace. Right off the bat, it might be looking at what's the culture here. Does the group of employees typically all stop at the bar after work? And is the supervisor right there leading them to the bar? At company functions, is it common to have alcohol present? I'll tell you, probably yes, it is. but is it an open bar? How is it encouraged? You know, some of those different things that, as we know as preventionists, lead to creating what that culture is. So there's a lot of good tools out there that employers can look at and use to assess what is their work environment and how is it contributing or not contributing to substance use, substance misuse, positive mental health.
The last recommendation is on partnering with the community. And again, this recommendation is to strongly encourage employers and businesses to connect with those organizations, coalitions that are doing this work. The reason being is it benefits certainly both. It certainly benefits us as a coalition if we can build a partnership with an employer, because it enables us to reach another quote unquote captive audience, right? And, you know, it also benefits an employer because we can then become a resource and a source for information, materials, awareness, even education programming that employers can provide within the work site. So the benefit goes both ways. And certainly, probably that relationship needs to start with the coalition working forward and meeting with a business and letting them know what you're doing and how we can work together. And again, recognizing the fact too that the employees that are working for this business are members of the community, and so you know, we may as an employer or business be doing all the right things when it comes to worksite wellness and prevention programming and addressing substance use issues. But if those workers then are returning to a community where substance use is almost promoted, and there are environmental risk factors within that community that increase the risk for substance use, then that's going to have an impact on that employer as well. So helping employers understand that the broader community, the health and wellness of the broader community is necessary, is a necessary asset for them to be successful. Mm-hmm. Real quickly, just to go back to the prevention programming that I mentioned. In this section of the report, we do look at risk and protective factors. I focus, that's always my focus, and I think it's a lot of our focus in the work that we do. But we include in the report a list of contributing factors that increase the likelihood of employees engaging in problem substance use. Of course, you know, the number one issue is the first grouping is around stressors at work, right? Workplace culture, but also like Jill mentioned early on, that work-family conflict, where perhaps the demands of the job are creating stress at home, or there's stress at home because someone is living with an untreated mental health problem or substance use disorder. And so your employee is at work constantly preoccupied with how they're going to get help for this family member. So those stressors, but again, I think the big one here is the workplace culture. Like Jill said, what does that culture look like? And you see that mentioned again toward the bottom in the workplace what are categorized as factors around workplace social control. Are there policies in place? Are they enforced? You know, how is substance use viewed within that culture at the workplace? And then that whole issue of access, right? You know, this is especially true, like Jill said, in our state, right? So those are the three big categories around risk factors. Here's what the CDC suggests for creating a work site environment and culture that is focused on prevention. And again, it goes, you know, what are the policies? Are there clear policies that are promoted and talked about and enforced? Are there opportunities for an employee to seek out screening and brief intervention, or is that available if we're concerned about an employee? You know, can we provide that for them? Again, educational materials, the brochures, the pamphlets, all that stuff that we're pretty good at, you know, gaining access to. Are those available to readily available? Educational programming, is programming promoted or provided that integrates, and I think this is the biggest takeaway around the prevention section, is the best way to address this issue of substance use prevention, especially as we're talking about primary prevention, is to build it right into your workplace wellness program. Make it a part of the workplace wellness program, if you know, and if you don't have a workplace wellness program, you know, maybe not focus or target on substance use only, but work to begin to implement a full worksite wellness program that encompasses substance use. And then, like Jill said too, you know, create an environment that promotes responsible use, safe use, and you know, really discourage or limit access to alcohol, or use your company funds to provide alcohol at work-sponsored events. You know, again, this enforces or creates a culture that we're going to have fun as a company, and we don't necessarily need alcohol to have that fun. But and then I think the other big and then this is back to Jill's point, you know, provide insurance that to your employees that have benefits for this, that will help pay for some of this. But then again, the other big piece, and I think this is important too, is that whole work environment. You know, we talk about risk and protective factors. We talk about the importance of feeling connected, feeling appreciated, how that contributes to our mental health, whether it's within the family, within the school. Is the culture safe emotionally? Is it a safe place to work? So creating an environment that where it fosters that connection between employees and employers. Help employees build strategies for resilience, wellness, stress management, right? So again, creating that culture that promotes overall behavioral health and wellness. And then again, here are more recommendations. I like this one, and we're hearing this one more and more. Require that vacation time be taken. This is especially true probably for executives, for the Jill Gomez's of the world who are running businesses, you know, require that vacation be taken. Jill, have you taken a vacation lately?
I'm at home right now.
And then provide training, you know, to your supervisors around these issues. And so all of that is in this report with linkages, connections to more information and more resources that employers can use. And it, you know, from a coalition standpoint, it may take us to help them. So it may take us, I think one of our fears with this report is that there are printed copies and we just distribute the copies to employers. That's not gonna be an effective way for this information to get out there. But if we can take bits and pieces of this report and share that in bite-sized chunks with those partnership, you know, with those partners in the business world, they will be more apt to absorb it and be receptive to it. We all know that a report like this, unless you're passionate about it, unless, you know, you're a prevention practitioner, these reports get put on a shelf and collect dust. So we really, our hope is that people help facilitate the dissemination of this information by kind of breaking it down for them, for our partners, and giving it, feeding it to them in again, bite-sized chunks.
Yeah. So I know we're over time. I could talk for a long time about this, but it's really important for me too that, yeah, the report is only as good as people use it.
Mm-hmm.
So what has been said today that has maybe spurred some thought, spurred some strategies? Again, I said earlier, like, gosh, there's so much going on in the world and our communities today. Is this the right time to approach employers and potentially ask them to do more? Probably not. But what it is the right time to do is to have your coalition, or if you're that person at the coalition table where like this would be your role or your business or your expertise, is to be able to approach businesses or your chamber to say, how can our coalition or how can my business help support you and your employees right now? Is it by offering a 30-minute Zoom meeting for your employees just about how to take care of themselves right now? I do my own employees. I work with a bunch of therapists. You'd think they would know this. They do know it, but they don't necessarily implement it, right? So as an employer, that's what I could do to support them. I'm going to give you an hour of time, paid time. There's cost to everything, right? And I have someone zooming in and can give you some strategies, right? Maybe that's something that business would grab onto, and there you've just formed a linkage and started a relationship. Maybe it's a listing of the local resources that you have that you can say, hey, I'm going to give this to the chamber. Chamber, can you make this available to all your chamber members? We just want to make sure that employers know what the local resources are if their staff are struggling with their mental health or substance use right now. I mean, I'm anticipating a spike in pregnancies and overdoses. So that's maybe really simple. Maybe you already have that resource list, and it's just making sure it makes it to the business community. It may be something that they can email out to their staff. Maybe they have a regular newsletter that they send out. What little piece can we offer? Because as coalitions, I know that we put a lot of focus on schools, using schools as the vehicle to get to youth. Employers are the vehicle to use to get to our adults in the community. So it's thinking about what little piece can we do right now It's not about getting businesses to your coalition so that they can donate to you. It's about what can our coalition and my business do for you right now, because we're in the business of promoting healthy, happy lifestyles. This is what I can do for you. That's all it is right now. This is what we could do for you right now and your employees. And things may evolve later on down the line. It might be that later on down the line, that business, you are able to offer mental health first aid training to the supervisors. Like, that's a big thing. Let me tell you, we didn't even talk about OSHA safety standards, but a lot of this stuff fits with that OSHA stuff. And those OSHA videos, those safety videos and management training videos that employers purchase are dreadful. They're so boring. Oh my goodness. I'm sure all the managers and employees sleep through those videos. We probably have all seen our fair share of them. So you can be that voice to say, I can provide that engaging local training to your managers, because that's an OSHA requirement, if that's applicable to their workplace. My hope today, as we have gone over our time, is just that this perhaps has spurred some of those ideas. What little piece could you take from this? And then when you're able to get that hard copy report or the report on the website, is to dive in a little deeper and just have it be a starting point for yourself. I'm always available for some additional conversation or sharing additional thoughts. If my contact information isn't included in the presentation here, Phil has it. I'm more than happy. Like I said, I could talk a lot about this topic because it certainly is connected to my organization's mission of helping our individuals and families and communities in, for people that are struggling with substance abuse and mental health issues. It's connected to my personal mission. This is what I love to do. This is what I feel passionate about doing. And that is why all of you have joined this Zoom call today too. You feel a passion for it. So use some of these ideas as tools to potentially tap in to a different or a new segment of your community.
Thank you all very much.
Sorry, guys, I'm mute. Thank you, Chris and Jill. Does anybody have any other questions for Chris or Jill?
Awesome.
I'm afraid to ask the question because it's so late here. I just want to make a quick observation. When going back to the community piece, when you have a factory and industry and you're talking about the workplace culture, and it's just assumed that when the shift is over, everybody's supposed to go across the street to the local bar, and the business is expecting that influx of people to take care of their business, to get the revenue that they need. So I guess it's sort of like, what do you say to a local business to assist you as an employer and still try to work together on this matter?
My thought on it, a couple thoughts that jump right to mind is, number one, we have to acknowledge that not everyone drinks is going to experience problems. And so probably what is underlying that trip across the street to that bar is that continued connectedness with their coworkers, the benefit, right? So I would start with that. No, I mean, logistically, does that bar serve food too, right? That's one question. Yeah. And if they do, hey, fantastic. Maybe it's working with that bar to promote not just a drink special that follows that 3 o'clock end time, but what about that food special, right? So some of those kind of risk reducing approaches, but from an employer standpoint, you could say, you know, hey, not everybody is going to experience problems because they go and have a drink across the street in the bar. But let's look at those few people that they may be experiencing a problem, that they don't go and sit on that bar stool and have 1 or 2 drinks and then go home to their family, that it turns into 6, 7, 8 drinks and they're still sitting there in the evening. How can we help those employees?
Mhm.
Those are just my initial thoughts, right?
Yeah.
That's the stigma against prevention coalitions, is that we're anti-alcohol. We know that's not true. And that, because that's a huge, that's a huge wall that you run into. So it's acknowledging that everybody experiences. And are there other opportunities that an employer can offer that fosters that connectedness for their staff, but it's not across the street in the bar?
Okay, thank you.
Mm-hmm.
Anyone else have any questions? Again, this is being recorded and it will be available on our MemberClick site in the future, so that if you have colleagues who might be interested, it'll be available. I'm sure that we will be hearing when this report is out in the online version, and then when we also get our hard copies will probably be distributed at regional meetings for our folks. So we'll certainly be able to hand one out to each coalition. But as Chris and Jill have said, you know, when it's available online, we will send that link out for folks to access that. And, you know, more than ever, I think a lot of our businesses are looking for help, and coalitions have a unique role to play in offering assistance. And, you know, oftentimes we can be tremendous resources, but we need to think of ourselves as a resource. Yes, we're trying to address problems, but we can be a tremendous resource for people in our community, and not just schools. I mean, Jill made a great point. We spend a lot of time trying to reach kids and parents through the school system, but utilizing our opportunities, working with agencies and businesses, human resource departments, Chamber of Commerce, those sorts of places. You know, it's a great way to get messages out to adults, and we need to, you know, be thinking along those lines as well. And one of my hopes is, from what we've done with our technology, you know, we might be opening up a whole new opportunity to really reach out to more people as we go. So thanks again to everybody. I see some folks have been leaving. If there aren't any more questions, we're going to wrap this up. So special thanks to Chris and Jill for joining us. And folks, we will be having another training next Thursday at 11 o'clock. And we're going to be talking about social determinants of health and health disparities within the community work. So we look forward to having you back. Hope everybody has a good weekend. And for those in the Northeast region, we're having our regional meeting virtually tomorrow. So looking forward to touching base with some of you tomorrow. Have a good day, and we'll see you later.
Thank you.
Thanks, Jill.
Very much.
Yes.
See you, Jill. Thank you, Phil.
Yes, thank you.
Yep.
Thank you.
Great job. We'll see if we'll hear you online tomorrow, Jill.
I thought you're doing SCAODA tomorrow.
Yeah, Jill and I will be at SCAODA. It's right at the same time, so
Yeah,
I've got
I hear you.
I got to give the prevention report, I think. So
Yeah, not a problem.
yeah.
That
How are you-
interim status certainly is not very interim, Chris?
No, they're milking it. They're really milking it.
Yeah.
So
Oh, awesome. Hey, thank you for this opportunity.
As they
Yep.
should.
Great.
see you guys.
Okay,
Bye-bye.
see ya. Bye.
Bye.